So I'm just going to talk briefly about the situation in Mississippi because many of the hospitals on here are from Mississippi. CHAMPS works with 39 hospitals in Mississippi, and we have been working with you for several years, and we work on breastfeeding and baby-friendly practices. And I'm going to present a survey that the hospitals in Mississippi responded to. We had 18 hospitals who replied by the 21st of May, which was last week when we put the presentation together. We have had several more of you reply since, and we would really like for you to reply if you haven't, because it's really nice that we have this big group of hospitals that we're working with just in Mississippi, so we can see how they are doing. Next slide, please. This is the data from the Mississippi Public Health Association, Department of Public Health. I believe most of you are probably familiar now with the fact that your Department of Health in your state is putting out data on COVID. When you look at this, this is just cases across the state of Mississippi, and the gray area towards the right is like data that has not yet been updated. So really you're looking at the last peak before that. And Mississippi has not had very many cases, but certainly they're really sort of on a slow rising trend. So I certainly would be saying, you know, given what we've talked about with our people from last week from New York, and these people and also who live in Boston, where it has been very critical, don't let your guard up yet, because certainly it hasn't gone away from Mississippi, and the trends are going up. Next slide, please. And this is the areas of Mississippi where you have the concentrated COVID cases. As you can see, the Jackson metro area, and then down on the coast. And as we have mentioned before on these webinars, and it's sadly the case throughout the country, minority populations are suffering the most. So you can see that the deaths in the Black population are higher than those in the white population, even though there are somewhat, just a little bit more higher percentage of white people that live in Mississippi than Black people. The percentage of death among Blacks is much higher than in whites. Next slide. This is what we always sort of reassure ourselves with on these webinars. As you can see, the number of children who have died from COVID is non-existent in Mississippi at this time. And the cases in young children are very low. Now, yes, there's always caveats about testing, et cetera, but we do know that in most cases, in most children, cases are not very severe, and the younger the child, the less severe outcomes they have. There are some new things emerging about multi-symptom cases in children who've been exposed to COVID, but as a rule, children are less unhealthy and very unlikely to have mortality from COVID. Next slide. And again, this is just showing the number of reported cases in Mississippi in the different age groups of children, so that even with those under 18, you can see that the highest number is by far in the highest age group. Next slide. So this is from our survey, which, as I mentioned, has 18 hospitals reporting out of Mississippi, 18 birthing hospitals. And so you can see that slightly over half of our respondents had a person who was either confirmed or suspected of having COVID-19 when they came to give birth. Next slide. We too differentiated between screening and testing. We found that everybody who responded to this survey told us that they screen maternity care patients, so that would be with temperature and symptoms, etc. And 44% were testing all maternity care patients when they came in. Next slide. We have a quick poll for you here. Next slide. Can you put the poll up, Metal? So just all you need to do here is click on the question, on the response that you believe will answer the question. We are not taking record of who you are or where your hospital is or anything. It's completely anonymous, but we just would like to know, can you just click on your answer? When do you think, and I know this is sort of fun question, when do you think your maternity will stop screening patients for COVID-19? It's just a guess. Everything in here is guesswork. We do have another poll or two coming up, so be ready. Okay, next slide. We also asked everybody what their approach was to test newborn babies. And this was kind of interesting compared to also Meg's data. So 60% of women of hospitals are testing the babies of mothers who test positives. And then 15% of hospitals are testing the babies of moms who are persons under investigation. And one of the hospitals said they weren't testing any babies. Next slide. All the hospitals have changed their visiting policies. 100% of the Mississippi hospitals told us both this time and the previous time when we did the survey that they were changing their policies. And so these are the results. You can see that the vast majority allow just one support person with the mother. Next slide. Skin to skin for healthy mothers and babies. You can see that 65% of our hospitals continue to do normal skin to skin care. So one hospital's adding infection prevention measures, and another 3 of the hospitals use a shared decision-making approach. And I just do want to point out, as we go to the next slide, please, that all of the hospitals that we're working in Mississippi are working towards baby-friendly designation, and over half of them are actually designated. So this is among a population of hospitals which is really doing these practices to begin with. If a mother has COVID positive, then only one hospital was continuing the normal skin-to-skin practices, and you can see here that they were using infection control measures or shared decision-making. 3 of the hospitals did say that they were not allowing skin-to-skin for women who were positive or under investigation. Next slide. Rooming in for healthy moms and babies, 78% of the hospitals adhere to the normal rooming in practices, which based on this group of hospitals is 24-hour, 23 to 24-hour rooming in along baby-friendly guidelines. And then a couple of the hospitals said that they, actually 4 of the hospitals said that they were actually strengthening their rooming in guidelines so that moms and babies that were healthy would stay together, and that would prevent them from being exposed to the infection elsewhere in the hospital. Next slide. For the COVID positive moms and babies, they were suggesting that they use additional practices to prevent the COVID being shared between the mother and the baby, and also using a shared decision-making approach. Next slide. I'm actually, we're actually at the top of the hour here, and I don't want to rush this too much. So I think what I'm going to do, can we just flick through the slides, and I won't read any of them, and you can just look at them. And then these will all be available online afterwards. So just spend a couple of minutes looking at these. And I do apologize that we have had to go so quickly at the end of this webinar, but we don't have time for it. This is one that's a little bit unusual. The survey results show that we did ask people whose guidance they use, because as our previous speakers have mentioned, some of these guidelines are somewhat conflicting with each other. So when we asked people whose guidelines they were using to set the policies by, this is the response, which is kind of interesting. So about 37% said they follow the CDC guidelines, 28% said the AAP guidelines, 19% were using the WHO guidelines, and 7% were using the ABM guidelines. Next slide. And this is just some additional things that people talked about when we asked them, was there anything else they wanted to share with us? So you can look at these. A couple of places, and we've heard this in other states, were requiring, for example, that if a hospital support person was coming in with a mother, they had to stay for the full duration of the mother's stay. They could not leave the hospital, or if they did, they could not come back until the mother herself left with the baby. And as you can see, many of the staff and employees are wearing PPE in all situations during labor delivery for all staff. Next slide. So we have a couple of polls that we'll just wrap this up with. Okay, so here's the poll. And if you don't have the chance to respond, you can at least think about it, okay? So I'm very interested in your responses to this poll. Do you think that the changes that have been made for COVID-19 will result in long-term changes in maternity care at your hospital? Is it going to make a difference beyond, the duration of COVID-19, or do you think everything's going to go back to normal? And your responses are, yes, I think some of the changes will continue. No, I think everything will go back to quote unquote normal, or of course you may not have made any changes, so there's nothing to keep the changes. So please, can you click on what you think is your response for your setting? And again, all anonymous, just a sort of fun poll to get some opinions from people. Okay, and then I think we have a final poll before we go over to our question period. Okay, so this one really was for fun, guys, okay? You know, I sort of started hearing this language about shared decision-making coming down from the CDC, and I was like, it's really interesting. We haven't really been talking about shared decision-making, specifically using that phrase in terms of the hospital that I've been working with for many, many years in our baby friendly work. So I was curious, was the concept of shared decision making in use in your unit before COVID-19 came along? Yes, we were already using shared decision making to guide practices. And of my dear friends in my Mississippi hospitals, if you were, we have not discussed this. So it's really nice that it came up. Then I knew the phrase shared decision making before COVID-19, but we were not practicing it. And then be honest, honestly, I'd never heard the phrase shared decision making. Now, this is a bit of a tongue-in-cheek question, okay? But I certainly seen this cropping up a lot since COVID-19 things came in, and it's a bit of a buzz phrase. So I just want to know for fun, was this really around before, and were everyone familiar with this concept or term? Or do people, you know, have people sort of taken this on suddenly, and maybe this is one of the things that will remain. It will be remaining as a, you know, a thing to do, and we can all discuss things like this in the future. This last slide, all of these guidelines are on our CHAMPS website. We have a whole section of the CHEER, which is the organization over CHAMPS. Our CHEER website has a whole section on COVID. And all of the guidance that you can see on this slide is there, and the links are there. So if you want to go and look at that, you can look at all this different stuff on our website as well.